Hi, this is Dr. Molly with Your Goals Physical Therapy. And today I wanted to get on here and just talk about how you know if you need to go seek some, professional help for like your shoulder. So it's so common to be working out and you go to do one last rep and all of a sudden your shoulder starts to hurt. Or maybe sometimes people actually hurt it while they're running. They notice that they start getting some pinching sensations or some aches that happen just from running. It could be from throwing a ball, which is, again, very common. And then there's sometimes where it's like sneaks up on you, where you're kind of getting used to using your mouse and all of a sudden your shoulder's starting to bother you. And it can get to the point where it just bothers you all day, every day. And it can bother you wherever your arm is. So if it's hanging, if it's close to you, if you're at rest, you're moving it, whatever. So then you just, your mind starts to go, right? When do I have to go see a doctor? When is this bad enough that I need to go see somebody versus just icing it and letting it rest and not working out or not doing something to let the injury heal itself? So first couple things. If it's your rotator cuff, you'll find a couple things are a little bit easier to tolerate. You'll like it when your arm is resting on something. So it doesn't have to be like resting where your shoulders are up here, but just kind of comfortably, just having your elbow supported. Some people find that they just naturally levitate, even hooking their thumb in their button-down shirt, just so that their arm isn't just hanging by their side. They find that when they sleep, they have a hard time especially if you're a side sleeper, they find a hard time getting comfortable because their arm is just always like aching or throbbing. So my trick for that is pretty simple. If you're in bed and you have a pillow, your arm just wants to be supported is basically what it's telling you. So as long as there's something on like underneath your arm and not letting it just dangle or like flop around, it's going to be more comfortable. May not be super comfortable. It may not be 100%, but at least it'll take the edge off and allow you to get some sleep. Hugging a pillow while you sit and relax and watch TV, just putting your arm into make a little cave for it so it doesn't feel like you have to hold your arm. You can just let it sit and it's not going to fall off. That is also super nice. I'm a huge component of ice. If you can get like a bag of peas to wrap over your shoulder, just 10 minutes, 15 minutes max, and that should at least take the edge off of what happened throughout the day. And then, so that's kind of if you have like a little bit of a rotator cuff tear. And that always sounds really scary. So if my rotator cuff is torn, do I need to go see a doctor? And that really depends on how much it's affecting you and what you're trying to get back to. So to kind of help tease through some of that, if your rotator cuff is torn, like completely, you're missing one of the ligaments in there and it's just completely gone, you will not be able to raise your arm. So at all. It'll be stuck by your side. You'll be trying to get your arm to come up and nothing will happen. It won't matter how hard you try, it will be stuck by your side. So that is an immediate, go to your doctor. You need to get a primary care, probably an ortho evaluation because there's nothing left. Now, if you're able to move your arm, it's just uncomfortable, then there's just a varying amount of a tear. And that really can heal, and you can have full range of motion in many cases without having to have surgery. Now there's obviously, everything's a little bit different, but ultimately a lot of people are walking around with shoulder tears that don't even know it. And they're lifting weights, they're doing whatever, and it's just a matter of correcting a few things and working on balancing some strength and some range of motion, and the tear not only won't get worse, your function will get better. And that's without medications, injections, or surgery. So how would you tell the difference, right? So again, if you can't move your arm at all, I would go see an orthopedic specialist because that's something that's pretty significant. But let's say you just injured yourself at the gym, and icing it and resting it, like I just said, helps, then that's actually fabulous because then you're a perfect candidate for having physical therapy help you work on whatever caused that injury from happening again or getting worse. So that can be something as simple as working on postural muscles, so getting your shoulders back, your posture in better alignment. It could be simply stretching some muscles. And then it could be balancing the shoulder strength, because sometimes people are a little imbalanced. Some shoulder muscles are dramatically stronger than others. It could even be that your stabilizers are not strong enough to keep up with the big muscles. So there could be like minor tweaks that can make huge impacts on the amount of pain that you're dealing with and the amount of function that you're trying to get back to. So I'm going to review some of my little tricks, right? So if your shoulder is just aching all the time, ice is your friend, and you can ice every hour, right? You can ice every hour for 10 minutes, and there's no side effects other than a cold shoulder, right? Then you can try to support your elbow and let that relax, because that's allowing your rotator cuff to take a break. Because many people, when you're just letting your arm hang, that rotator cuff has to work. And so that's what it's trying to do. It's trying to give itself a break. So just letting your elbow rest on anything, whether it's a pillow, holding it, an armrest, just let it take a break. And that should help at least bring down the pain symptoms. And then try to come and see a physical therapist and have them do a movement assessment or a movement screening. And then that'll give you a much better picture of what's actually going on. There are lots of things that can be done to get you back to your sport. So if you know somebody suffering and trying to figure out whether or not they should go to a doctor or try to do something different, have them watch this video. If you have any questions about the content that I put in here, by all means ask questions, because I love them. And I hope you guys are having a great start to your week. Have a good